Okay.
36-year-old Jane Siamutabe is lucky to be alive.
I was in labor for 3 days alone at home. When I finally got to the hospital and they did the cesarean section, they found the baby was already dead.
Jane's story is not unique. Thousands of rural women like her in her native country of Zambia in Southeast Africa deliver their babies unassisted at home. Many of them are young, their pelvises too small for a baby to easily pass through, a fact that puts their babies and themselves at risk. Dr. Michael Green is a volunteer surgeon at Zambia's Monze Mission Hospital.
When a lady is in labor for a few days, when the labor becomes obstructed, what happens is that the pressure of the baby's head causes a hole to develop between her bladder and her vagina.
It's a medical condition known as fistula, and it leaves a woman completely incontinent. The head of the Global Fistula Campaign for the United Nations Population Fund, UNFPA, is Dr. France Donnet.
When those women are left incontinent, often they are abandoned, they are ostracized, they are stigmatized, they cannot stay with the family, so it's a medical problem, but it's also a social disaster.
What's more, while this problem can be corrected with a simple surgical procedure, few of the nearly thousands of women suffering in Zambia alone ever receive it. In a country with overwhelming poverty and high rates of deadly diseases like AIDS and malaria, medical services are overburdened, and fistula is not among the priorities. Zambian Minister of Health, Dr. Brian Chitwu.
The non-communicable diseases are on the increase, and the communicable diseases. As if that were not enough, we have the HIV/AIDS pandemic.
Stepping in to help is UNFPA and international donors who together created and fund Zambia's first fistula program.
This lady has got a psychovaginal fistula, and all we're going to do is just close the hole. Because she has that hole, she's got incontinence of urine, so she's leaking urine. Luckily, her hole is not too big. It shouldn't be too difficult to do.
Dr. Green, together with local doctors and nurses, now performs 1 to 2 of these surgeries a week at a cost of just $300 per operation.
It was a nice case. There was no trouble closing the hole, and she should have a good outcome following the operation. Mary, tell me that's the letter for the hospital. Okay.
They also help these women,
I'll tell you that's the money for the bus fare.
Many of whom were brought in from remote parts of the country with their long journey home. After 6 weeks in the hospital, that's exactly where Jane is headed.
I am so happy to be home again with my children because I didn't know if I was ever going to come back to them.
Grateful and healthy after receiving the surgery, Jane now has the chance to heal and raise her remaining children in a community that now accepts her. This report was prepared by Camille Taha for the United Nations.